Hello, I am Dr. Farshad Amini Behbani and this is short course of Iranian traditional medicine. In this section we discuss about interpretation of the pulse. What that you feel under your fingertips on radial arteries on the both side could be divided in 4 Aristotelian causes. At first, you should notice two formal cause. What is the shape of the pulse? How much is its volume? How much is its speed? How much is its frequency? Is it regular or irregular? Is it harmonic and rhythmic or not? At the another level, you should notice to the force, to the efficient cause. Is it force strong or it is weak? And you should notice two material cause, vessel wall and what is in the vessel. I mean blood. Is the vessel wall hard, usually dryness, or a tension or an inflammation in some part of the body can cause hard vessel wall. After that, you should notice the causes of dryness, for example. For example, when you have too much consumption of dry food or dry medication, or when you have too much expelling, or when you have sleeplessness, or when you live in a dry temperamental area, and of course some hard inflammation or dominancy of dry humor can cause hardness in the vessel. In fullness, you feel so much blood or fullness under your fingertips. These are part of material cause. On the other hand, you may feel softness on the vessel wall. Usually, wetness is the main cause of softness, and you should think to the wetness causes. For example, too much sleep, too much consumption of wet temperamental food, or living in wet area. You should find these causes from the section that is related to dryness and wetness causes. At another level, you should notice two final cause, the main cause of the pulse. Final cause or need is because of the action of the pulse, main aim of the pulse. Pulse is done because we have to cool the spirit, usually by expansion of the pulse, and we have to expel extra vapors and smokes by contraction in the heart or in the vessel or in the lungs. If need increases, for example, in warmness of some part of the body, in warm distemperament, or when we have extra vapors, for example, in infection or in obstruction, that the body needs to have a stronger move, have a more efficient move to expel them. Or sometimes that we need to more production of the vital spirit, for example, in the weakness of psychic spirit, In memory loss, for example, we have need to more production of vital spirit as the base of psychic spirit to increase the amount of psychic spirit. We have increase in need. Increase in need show itself in increasing in volume at the first. The nature try to compensate the increasing of the need by increasing the volume of the pulse in 3 dimensions. I mean length, width, and height. If there is no barrier for this increasing in volume, sometimes we have barrier. We have some inability to increase the volume. But if the vessel wall is flexible, the nature could easily increase in the volume. And after that, the nature try to compensate the increasing of the need by increasing the speed of the pulse. And after that, by increasing in the frequency of the pulse. And sometimes we have decreasing need. For example, in rest position, in coldness, called intrinsic temperament, called sex temperament, or called age temperament, or called distemperament. We have decreasing need. So the body feel no reason to increase volume or speed or frequency. Contrary, the body begin to decrease frequency at the first and then decrease in the speed, so pulse become slow and distinct, and then by decreasing in the volume, so the pulse become small, slow, and distinct. This happens when we have decrease in need. We can see it in old age. In old age, we have a slow and distinct pulse. And of course, in cold distemperament and cold intrinsic temperament. The difference between slowness in cold intrinsic temperament and cold distemperament is the force. In intrinsic temperament, usually the force is intact. It is in its good condition. But in distemperament, in diseases, we have decrease in the force. And you should have distinction in diagnosis by noticing these 4 causes. When you feel a pulse that show increase in need, you should ask yourself why the need is increasing in this person or in this patient. Sometimes we have temporary increasing in need, for example in anger. Sometimes we have chronic increasing in need, for example in a fever. The difference is in a fever we have a weak pulse, especially if the fever is a chronic condition. But in anger, usually we have a strong pulse. And after eradication of the anger, the force and the form of the pulse become normal. But after eradication of the fever, usually force have need to more time to become normal. We have to give the body some time to compensate itself. So in patients after healing, we have weakness of the pulse. If we have any change in material cause, I mean in the vessel wall, the body cannot compensate the increasing in need by increasing in volume easily. In this condition, we have not increasing in 3 dimension. We just have increasing in the length. So at first, in a dry body or in melancholic dominancy, melancholic humor dominancy, we have long or forefinger pulse. And by increasing the need, we have increasing in speed. So we have 4 finger pulse in length and narrow in the width and height. So we have narrow, long, and fast pulse. That's the pulse of melancholic humor dominancy. In the blood humor dominancy, we have a wet and warm humor. So we had wetness, so we have a little wide pulse, and we have warmness, a little warmness that cause a little increasing in the need. So the pulse is 3 finger in length, wide and high pulse with a little speed. And of course, a little fullness feeling on the finger. This is the pulse of dominancy of the blood or sanguine humor. In dominancy of choleric humor or yellow bile, we have the humor that its amount is little compared to the other humor, but is increased in compared to itself. We have a warm and dry humor. Because of dryness, the body cannot compensate in the whites, or because of too much warmness of the choleric humor, we have increasing in need that the body cannot compensate it just through the increasing of the length. So the force becomes weak. When force is weak, the pulse becomes small, but the force is enough to increase in speed and the frequency. So we have a small, rapid, and frequent sometime pulse. Rapidness is the main sign of choleric humor dominancy. And if we have dominancy of the phlegm is a wet and cold humor. Because of coldness, we have decrease in need. So the pulse becomes slow and distinct. And because of the coldness, we have no need to increase in volume, so the pulse becomes small, usually 1 or 2 finger in length, but the whites become large because of the wetness of the phlegm humor. We have a wide, a small, a slow and distinct pulse in dominancy of the phlegm. And when we have weakness in the force, the body cannot compensate by the volume. It begins compensation by increasing in speed and frequency.